I find this job to be incredibly fulfilling, and we can make a huge impact as nutrition professionals. I'm Lara Field. I'm a registered dietitian nutritionist from Chicago, Illinois. So when I was a kid, I was 10 years old, my dad came home from a doctor visit one day, and he was diagnosed with very high cholesterol. His dad had passed away of heart disease, so when he got this diagnosis, it was really scary. We went from, bacon and eggs to oat bran, and I was really inspired as a young child. It really shaped who I am, and I realized that I could be a dietitian and teach people how to change their future. Because I learned about nutrition at such a young age because of my family, I really always felt working with kids was so important. So once I graduated grad school, I worked at University of Chicago for about 10 years in the pediatric GI department. I also worked at Lurie Children's Hospital in the Peds GI department and also in the ICU, and gained incredible amount of clinical practice in both of those institutions. After working so many years and as a clinical dietitian, I really wanted to expand my reach. So I started my private practice called Feed Nutrition Consulting. FEED stands for Forming Early Eating Decisions. I started for a few years on my own, but then when the demand got a little bit higher, I knew that I needed other dietitians as part of my team too. Dietitians that were specialized in things that I wasn't specialized in. We could expand our reach to other people. As I started working with more kids and families, there were more adults that wanted to work with us as well. So we transferred FEED into Feed Nutrition Consulting, a kind of one-stop shop for the whole family. And my day-to-day now, I work with kids and families one-on-one in consultation in home or in our office. I also do a lot of other things like pantry overhauls, and we go into the pantry and look at nutrition facts labels in someone's own home, so it's a really intimate experience. Some things that we're working with are very sensitive and maybe a little bit hard for parents to manage, and so it's really a lot of hand-holding and cheerleading, and we have telehealth consultations and the ability to reach people that maybe we wouldn't have reached before via telehealth gives some of our clients a little bit more privacy because they would rather see us behind a screen. So I find that our offerings are very diverse and really helpful for a lot of people. Having a private practice enabled me to really be flexible for the demanding needs of a new baby. So as I was starting my baby of Feed Nutrition Consulting, I also had a new baby at home. And it was an incredible, rewarding experience to start both at around the same time. There are more and more people that realize the importance of dietitians and the fact that we can help really prevent future disease. And so seeing people succeed or have a better handle of their own health is incredibly rewarding.